Interviews for doctor positions, whether in hospitals, clinics, or specialized medical centers, are designed to evaluate not only your medical knowledge but also your interpersonal skills, ethical judgment, and ability to handle high-pressure situations. Employers want to ensure that candidates are capable of delivering excellent patient care while working collaboratively with other healthcare professionals. In addition to assessing technical expertise, doctor interviews often focus on communication, decision-making, empathy, and problem-solving. These competencies are crucial for maintaining patient safety, adhering to medical protocols, and fostering trust. A well-prepared doctor interview requires balancing clinical knowledge with interpersonal skills and ethical reasoning. This video provides common doctor interview questions, sample answers, and tips to help you prepare effectively. The answers are structured to be clear and concise, while highlighting both medical expertise and personal qualities that make a doctor successful. Question 1. Tell me about yourself. Answer begins here. I am a dedicated medical professional with experience in specialty. I have worked in diverse healthcare settings, managing both routine and complex patient cases. I am passionate about patient care, continuous learning, and collaborating with multidisciplinary teams to provide the best outcomes. In addition to my clinical skills, I value empathy, communication, and ethical practice in every patient interaction. Tip: keep your answer concise, emphasizing relevant experience, specialty, and personal qualities. Question 2. Why did you choose to become a doctor? Answer begins here. I chose medicine because I have a strong desire to help people and make a tangible difference in their lives. The combination of scientific problem-solving and compassionate care appealed to me. Throughout my education and clinical rotations, I found fulfillment in diagnosing and treating patients, which reinforced my commitment to this profession. Tip: show genuine passion and motivation for pursuing a medical career. Question 3. How do you handle high-pressure situations? Answer begins here. I handle pressure by staying calm, assessing the situation methodically, and prioritizing actions based on urgency. For example, in emergency cases, I focus on stabilizing the patient, delegating tasks efficiently, and maintaining clear communication with the team. Remaining composed ensures better decision-making and patient outcomes. Tip: highlight composure, prioritization, and teamwork under pressure. Question 4. Can you describe a difficult case you managed? Answer begins here. During my residency, I treated a patient with multiple comorbidities who presented with acute symptoms. I conducted a thorough assessment, consulted with specialists, and implemented a multidisciplinary treatment plan. The patient's condition stabilized, and the experience reinforced the importance of collaboration, critical thinking, and patient-centered care. Tip: use real-life examples to demonstrate problem-solving, clinical skills, and teamwork. Question 5. How do you stay updated with medical advancements? Answer begins here. I stay current by regularly reading medical journals, attending conferences, participating in workshops, and engaging in online courses. I also collaborate with colleagues to discuss new research findings and emerging treatments. This approach ensures that my practice reflects the latest evidence-based standards. Tip: emphasize continuous learning and dedication to professional growth. Question 6. How do you handle patient communication, especially with difficult patients? Answer begins here. I prioritize active listening, empathy, and clear explanations. For patients who are anxious or upset, I take the time to understand their concerns, answer questions patiently, and provide reassurance. For example, explaining a complex treatment plan using simple language helped a patient feel more confident and cooperative. Tip: highlight empathy, communication skills, and patient-centered care. Question 7. Describe a time when you had to make a critical decision quickly. Answer begins here. In the emergency department, a patient went into sudden cardiac arrest. I quickly assessed the situation, initiated CPR, and coordinated with the team for advanced interventions. The patient responded positively to treatment. This experience demonstrated my ability to make prompt, informed decisions under pressure. Tip: show decisiveness, clinical knowledge, and teamwork. Question 8. How do you manage work-life balance as a doctor? Answer begins here. I manage work-life balance by organizing my schedule, prioritizing tasks, and setting boundaries where possible. Regular exercise, family time, and personal reflection help me maintain focus and prevent burnout. Balancing personal well-being ensures I provide the best care for patients. Tip: demonstrate self-awareness and strategies to maintain professional performance. Question 9. How do you approach ethical dilemmas in medicine? Answer begins here. I approach ethical dilemmas by referring to established medical ethics principles: autonomy, beneficence, non-maleficence, and justice. I discuss cases with colleagues or ethics committees when necessary and ensure decisions prioritize patient welfare while adhering to legal and professional guidelines. Tip: emphasize ethical reasoning, collaboration, and patient-centered decision-making. Question 10. What is your experience with electronic medical records, EMRs, and technology in healthcare? Answer begins here. I have extensive experience with EMR systems for patient documentation, lab tracking, and treatment planning. I also use medical apps and online resources to support clinical decisions. Technology enhances efficiency, reduces errors, and improves patient care when used effectively. Tip: highlight adaptability and tech savviness in modern medical practice. Question 11. How do you handle mistakes in your practice? Answer begins here. If I make a mistake, I acknowledge it immediately, take corrective action, and inform relevant team members. I also analyze the cause to prevent recurrence. For example, reviewing a medication error helped implement a checklist system that improved safety for future patients. Tip: emphasize accountability, learning, and proactive improvement. Question 12. How do you ensure patient confidentiality? Answer begins here. I strictly adhere to legal and institutional guidelines regarding patient privacy. I only share information with authorized personnel and maintain secure documentation. Respecting patient confidentiality is essential for trust and ethical medical practice. Tip: highlight knowledge of privacy laws and commitment to ethical practice. Question 13. Can you describe a time you worked effectively in a multidisciplinary team? Answer begins here. I collaborated with nurses, physiotherapists, and pharmacists to manage a complex patient case. We held regular meetings, shared insights, and coordinated interventions. The patient's recovery was successful, and the experience reinforced the value of teamwork and communication across disciplines. Tip: focus on collaboration, coordination, and positive outcomes. Question 14. How do you educate patients about their conditions and treatments? Answer begins here. I provide clear, concise explanations and use visual aids or analogies when appropriate. I encourage questions and check for understanding. Educating patients empowers them to participate actively in their care and improves adherence to treatment plans. Tip: emphasize communication skills, patience, and patient engagement. Question 15. Why should we hire you as a doctor? Answer begins here. You should hire me because I combine strong clinical knowledge, compassionate patient care, and effective teamwork. I am committed to continuous learning, ethical practice, and delivering high-quality care. My experiences have prepared me to handle diverse medical challenges while maintaining professionalism and empathy. Tip: summarize your skills, experiences, and qualities confidently. Closing thoughts. Doctor interviews assess both medical expertise and interpersonal competencies. Successful candidates demonstrate a balance of clinical knowledge, problem-solving ability, empathy, ethical judgment, and teamwork. Preparing involves reflecting on past experiences, identifying examples of critical thinking, patient care, and collaboration, and practicing clear, concise communication. Using structured examples, such as the STAR method, situation, task, action, result, can help organize answers effectively. Additionally, staying updated with medical advancements and understanding ethical and professional standards is crucial for demonstrating readiness for the role. By preparing thoroughly and articulating your skills, experiences, and personal qualities, you can leave a positive impression and increase your chances of being selected for the doctor position.